routine checkup. And as I mentioned, we're in the midst of it. It actually ends next Friday, May 15th. All of you should have received a mailer in the mail. And I hope you checked out the open enrollment web pages. They're very progressive this year, and new information is added every few days. On our open enrollment web page, we have a link to Alex, and you can, if you click on Alex, to walk you through the open enrollment process and reviewing health plans that are available. It actually prepares a cost analysis for you based on your usage. The link actually looks like this little picture that's on our open enrollment. So you need to re-enroll if you want to add, cancel, or change any of your plans, or if you want to contribute to a flexible spending account. So if you do not re-enroll and take action, you'll have the same plans that you do currently with health, dental, vision, voluntary life, and AD&D. However, your flexible spending account will not continue unless you have money that's being rolled over. Up to $500 in your balance can be rolled into the next year. We've had several questions. I asked the team earlier today, what are your number 1 and 2 questions so far this year? And number 1 is there any allowance to extend the time that claims may be incurred? And so far, the IRS has not extended that period. So claims still need to be incurred by June 30th for any flexible spending accounts that you have this year. If you are adding a dependent for the first time, you're going to want to gather your documentation. And here you can see, depending on the dependent, what documentation is required. Also, just a reminder, there's no need to wait for open enrollment if you want to decrease your optional life insurance, change your voluntary retirement plan.
You can do that as often as you like, or change your life insurance or retirement plan beneficiaries. So what's new for 2020? First of all, this is the second year we're offering the high deductible UK Savers Plan. And this plan works along with a health savings account or an HSA.
Sorry about that. I was just, my presentation was muted. Let's see, so the deductible must be met first before the insurance begins to pay for prescriptions or anything other than preventive care. Your out-of-pocket maximum is the medical plus the prescription combined, and the health savings account that runs alongside of your UK Savers plan will have a deposit of $1,000 for single coverage or $2,000 for family, any of the family coverage plans. $500 in the case of a single plan will be deposited in July, and the remainder $500 will be deposited in January. You actually will pay less by using UK healthcare providers because there's a lower deductible and a lower out-of-pocket maximum. Another thing that we added this year is a limited flexible spending account. So when you use an HSA, the IRS does not allow you to also use a flexible spending, medical flexible spending. So The limited purpose FSA allows you to still use your pre-tax monies for vision and dental expenses. The HSA is regarded as a triple tax savings. And you can add to the amount of UK contributions up to a total of $3,550 if you're employee only, or a total of $7,100 if you're family coverage. The triple tax savings comes into play because you are contributing with pre-tax dollars. Once you have $2,000 in your account, you can start investing that money, and this money rolls over from year to year. And it's actually a retirement savings for medical expenses. So the earnings grow pre-tax, and then when you do take the money out in retirement and use it for medical premium,
that also is pre-tax. Can you hear me? You can?
Yeah,
okay.
We actually, Gail, I figured it out. You can, I just muted your computer and then we're going to use your phone. So I think everybody says yes, much better. Sorry,
okay,
everybody.
perfect.
We're trying our best here.
Yes, I'm sorry too. I could hear myself talking and there's nothing worse than that. So also for those of you that participate in the PPO plan, prior to last year, UK healthcare providers required you to pay co-insurance, and this is across Anthem providers as well and non-network providers. So last year, there is an incentive if you use UK healthcare, and that's where the deductible is lowered and the healthcare is available for most services at a copay only. And the example is like a UK surgery, UK healthcare outpatient surgery only costs $100. So you save money by using the UK healthcare plan. The Delta Dental, UK Dental, and Vision, IMED, are offered at the same rates this year as they were last year. And our health insurance, even though we did have a planned rate increase this year, UK is picking up a higher portion in their UK credit that you receive towards the cost, so that employees will not receive or will not have an increase to their cost for 2020, 2021. Also, just a reminder that during this COVID-19, the testing and visits at this point in time through June 14th are available at a no member cost share. Overall, our increases are still below national trends, but it's very nice, and our costs compare favorably to benchmarks, but it is wonderful that we are not having to absorb any increases individually this year. And here's just a reminder of the different rates. Employee only $33 a month will stay the same for the HMO, UK Savers Plan, and PPO. RHP is $37, and the EPO is $237. That plan runs a little higher. Know Your Prescription Coalition, RX Coalition, is still available to you, and you can call them. You see the number on your screen. If you have any drugs that are expensive, or where there may be drug alternatives, or any questions, I will tell you out of personal experience, I had a family member that was placed on a specialty drug this year. The drug's cost was $3,000 a month. My copay would have been $1,000 because it's specialty, and they were able to find a program where my copay was $0. So certainly give them a call. It's worth talking to them. Flexible spending accounts. As you know, we talked about this briefly before. $500 may be rolled into the next plan year. Be sure to use your funds before they expire, and that means you need to incur the claims before June 30th. We have a link on our website, but it's also on if you're participating on the asiflex.com website, to a store where there's products listed that you can go out and purchase. Due to the COVID-19, there is some expansion on what's available for purchase. Some of the over-the-counter products have been allowed now where they weren't prior to this. The flexible spending limit is increasing for medical by $50, so it'll be $2,750 this year. Dependent care is $5,000, and that's $5,000 per household. The health FSA limit is an individual limit, not per household. So there are more ways to access your benefits. The Team Blue Clinic is dedicated solely to you, UK employees, and your family members. They offer routine primary care, and that's for adults as well as children, and same-day appointments. So a phone number is listed there if you're interested in trying out the Team Blue Clinic. Dr. Frazier is the doctor who works there, and then there's a PA as well. There's also telemedicine and online telecare. These are offered through Live Health Online and our UK telecare. So these are visits for primary care conditions. The co-payment right now is $0 for primary care, $25 for mental health visits. The reason for the difference between the two co-payments is the normal average medical visit is about 10 minutes, whereas the behavioral health benefit runs about 45 minutes. High satisfaction ratings. We also have we've also auto-registered you. So the registration process you won't have to walk through if you want to use these services. And then there's UK telecare that's brand new, and that is a telemedicine opportunity, and that will be available at no copay through June 14th as well. And from what I understand, that is very easy to use. And the Live Health Online, I have heard, has had some wait time recently with the COVID-19 and people not being able to go into their doctor, but UK telecare does not. So I would love to get feedback on anybody that gives that a try. So voluntary benefits are those benefits like cancer disease specified insurance, short-term disability, long-term care, universal life, auto and home, pet insurance, and legal insurance. And the MPM group is the broker who handles those insurance plans. So if you want to make any changes, I've listed their website. They do have online enrollment, so you can do this from your home. Also, their phone number is 859-223-4973 if anybody wants to call and ask questions. One reminder about the short-term disability is that if you signed up for this, even if it was a couple of years ago, and you signed up with a certain percentage of your salary in mind, you'll need to increase that amount if you're wanting to make a change. It doesn't automatically increase with any salary changes that you may have had. So a lot of folks don't realize that until they go to use it. Universal life insurance this year will offer guaranteed issue. This is separate from our optional life plan, which is based on your salary 1, 2, 3 times. There is no medical evidence of insurability required, and you can purchase a plan on yourself and your spouse or spouse. This is only going to be available at open enrollment, and what it means is basically if you have an underlying condition or a chronic condition, you're automatically approved. So those conditions won't work against you as far as being able to be insured. Universal life is a plan that you're able to take with you even after retirement or separation from the university. So for complete details, again, NPM is the broker for this insurance. And then MetLaw. So Hyatt Legal works with MetLife to offer the MetLaw plan. And these are legal services for will preparations, contract review, family law, financial matters, traffic and vehicle matters. I know I had my will and trust prepared, and the attorney that I worked with here locally said that, and using this met law, and so it was completely free. I just had my family deduction pulled from my paycheck every month. I think it was $22.50. And the attorney said that she prepared $3,000. She would normally charge about $3,000 for the services that she offered. So great deal, and I strongly recommend it. So we have more benefits in well-being. With nutrition, there's Eat Well programs. This is a personalized nutrition program. They offer individual consultations, online classes, registered dietitians with a holistic approach, and this is valued at about $500. Then there's the Naturally Slim program, which is all online, and that's so you have the 24/7 convenience. There's dashboard coaching, and there's 10 weekly sessions. And this is really a focus on how and when to eat, not so much what you eat, and it helps you lose weight and keep it off. It's just developing a new habit, and it's very interesting, and the cost is covered by the health plan. And so new this year, we're going to have a summer promotion or campaign, so look for that to come. We have the financial well-being. There was an article I read recently that said as far as mental health, financial stressors are number one, which you can imagine why in our environment. Enrich offers an online tool to make money decisions, education, information. You can sign up for a one-on-one consultation with our certified financial planner, Todd McCauley. We also have our retirement vendors, TIAA and Fidelity, and they are advisors, and they can offer online or virtual visits absolutely free. I also want to mention the SAVVY, the student debt loan forgiveness program. So since the University of Kentucky is a public institution, we're able to offer, we're able to sign off on for our employees this student loan debt forgiveness program eligibility. What it is you pay your student loan, the minimum payment, and it's based on your income for over 10 years, and any balance left is forgiven. There is an annual form that you have to have signed, and Records does that for free, but SAVVY actually helps coordinate and orchestrate the program. It's a wonderful program. However, it's not as simple as it seems that it should be. Out of about 86,000 people or applications into the program, only 865 have gone through, how do I want to say, that have achieved, the end forgiveness out of those 86,000. And we all know, well, I don't know if we all know, but 44 million of us in the nation have some type of or form of student loan debt. This could also be used for parent loans if you had a child. So it's all ages of us, and there's $1.5 trillion of student loan debt. So definitely you want to check it out. The first half of the SAVVY online program is absolutely free, and then you can determine if you want to utilize their coordination. And if you do, it's $60. Other financial benefits, of course, are retirement plans and the vendor resources, our paid leave and holidays, our financial well-being resources, a lot of which I just mentioned, the employee discounts through our discount program, the legal benefit, and the saver plan. Physical activity is very important during these times. We know the Move Well Fitness Center is closed for the time being. However, they are still offering, I see emails where they are offering online classes. We have the Move Well Rewards programs, group fitness classes, all virtually right now, and exercise consultations. And part of well-being, we are we are able to tap into all kinds of resources. There are counseling sessions that are available to us for free, consultations, practice groups. I see new telehealth has a tobacco treatment cessation program with free NRTs. The My Strength app and Future Moms is offered through Anthem, and Anthem is our administrator for our health plans. And these help with stress. Future Moms help with folks that are either planning on getting pregnant or who are pregnant, and they provide all kinds of free and valuable resources. And actually, they have statistics that show that, people actually do fare better with, using the program than those who do not. And then, of course, our medical plans have the mental health coverage. So all kinds of programs available for our well-being and caring for others through work life. We have the elder care program, and this can be used for family members that are out of state, and the Big Blue Family Care, and the Little Cats Guide. The Little Cats Guide are for folks who have, that are having babies and children, and the Big Blue Family Care is for care of family members. When I'm not certain how much it's being used right now, but students are vetted through this program and are available to provide that care. And then here's something that is probably being used more than before, and that's the workplace telecommuting. So there is a link on the Work Life page where you can go out and get tips on how to telecommute better. I might need those based on my issues with having the muting and unmuting in my phone. Flexible scheduling, and of course, reduced seasonal hours. So here's our contact information. If anybody has questions or wants to write these numbers down, the phone numbers are fully staffed, and we're answering emails and phone calls all day. So please use those. And at this time, I think we're opening it up for questions.
So Richard has been kind of filtering the recent ones, but I do have one question from someone. It says, I have a flexible spending account. Due to the COVID-19 situation, many appointments are canceled and one surgery, and the account cannot be spent by June 30th. Can the deadline be extended to 1 to 2 months?
I wish it could be. We checked with our consulting firm, and they checked with their legal counsel. Unfortunately, the flexible spending, because it is a pre-tax benefit, is under the IRS guidelines that we have to follow, Section 125, and there have been no guidelines allowing the extension of the time allowed for incurred claims. So there is on the asiflex.com website a link under their resources tab to a store where you might be able to spend down some of that money. I always tell folks, think outside the box. If you wear glasses or contacts, stock up. Get the pair of prescription sunglasses that you always wanted. I know it's a problem because of the number of phone calls and questions that we've had about it, and can certainly sympathize. But as of right now, our hands are kind of tied.
And just to reconfirm, I think Richard already answered this. Someone asked, the low copays are just for in UK providers, correct?
That is just for UK providers, yes.
Okay. And then
the lower copays.
Right. And then the last question that I had from earlier says, do you have to have MetLife to enroll with MetLaw?
No, you do not. So you just enroll with MetLaw. You will see a link on your employee self-service, and it's under the insurance tab where you can enroll during open enrollment for the MetLaw service. So it's one of those that you can only enroll or add or drop during open enrollment effective July 1st. So now's the time to do that. but you do not have to be enrolled in MetLife, any of their other like auto and home products.
Okay, and then someone asked, Cindy asked, I have the dental and eye insurance. My mother lives with me full time. Can I add her to both?
Unfortunately, no. Parents are not eligible dependents on our plan. And it's, yeah, unfortunately we cannot.
And then Kathy asks, can you participate in more than one HSA or FSA account? Say my husband has one at work. Can I do one at UK?
You can. So for the flexible spending, that's a slam dunk, yes. You can each participate. You could each set aside the maximum allowed by the plan, by your plan. However, with an HSA, unless the other is participating in a limited FSA, which we are offering for the first time this year, you cannot. So let's say my spouse has a HSA through his plan. I cannot participate in the flexible spending account, which allows pre-tax medical expenses at UK. I'd have to choose the limited flexible spending.
Okay, and then Leanne asked, can you speak to dental? I go to an out-of-county dentist, and they said my dentist was in network, but they called me if an enhanced plan. Is that the same as UK's highest Delta dental plan?
It is. Delta Dental within their plans, so they have different names for their networks. They have a Premier network and I believe what they call a PPO network within the dental plans. But both the dental plans, which we call ours Delta Dental Basic and Delta Dental Enhanced, have the broad Delta Dental network. It's just that within Delta Dental, and it's kind of hard to explain, they have more or less 2 different networks within the plan. And based on those networks, their usual, customary, and reasonable rate that are paid to those network providers are a little bit different.
Okay, and then we also have Alex doesn't let you compare plans for a situation where coverage is only for yourself and children, not spouse. Should I work with someone in the benefits office to estimate best path forward? Is that available? Absolutely.
And I'll have to look into Alex. I thought it did, but I'm not gonna, yeah. So absolutely, they can call us and we can walk them through the process and work with them to determine, help them determine what would be the best option for them. And they can just call the 257-9519 option 3 phone number.
Okay, I'm just doing some scrolling here, Gail, to make sure we didn't miss anything. Let's see, we might have. We just have a lot of appreciation for the great benefits UK offers.
I so agree. And that's thank you to our leadership.
Someone just asked, has there been a change to make electric toothbrushes an allowable expense if prescribed by a dentist?
I don't know.
Yeah,
but
I thought that was a pretty particular question.
Yes, that's a good one.
Yeah.
I'd be curious to know, and I will find out the answer and get back to you, Caitlin, if you can distribute the answer.
Absolutely.
Okay.
And let's see here. The UK contribution to HSA plans, is that made all at once or quarterly?
It's actually going to be made biannually. So this past year, it was our first year, and we were learning as we went along. It was made by months. Each month, it was divided up. So if it was $1,000, it was $83.33 each month. But we have learned that that's not, what a lot of our customers expected. And, you know, they would rather have access quicker to their funds. So we're going to put half in July, as soon as the plan's elected, and then the other half in January.
Okay. And then we have an IMED question. Someone asked, I tried to do a routine eye exam with a new eye doctor within the plan. However, they said because I have HMO, he was considered a specialist and he had to have a referral from my physician. Is that accurate?
Well, I guess it depends on what exactly the eye exam was for. So I know that if it's an ophthalmologist versus an optometrist, and the ophthalmologist is looking, you know, there's a pre-existing condition, you know, there's an underlying condition, I should say, like diabetes or glaucoma or something that is considered medical, for the medical plan to cover it. And actually, I think the provider probably just doesn't know our plan. Our HMO does not require referrals to see specialists. So it would have paid, you know, paid for that coverage anyway. But with the IMED plan, just for a visit to test, you know, eyesight for glasses and so on, there's no medical referrals needed, and it would not be medical. It would just be covered under my IMED. It should be a $10 copayment.
Right. She confirmed that it was an optometrist.
Yeah. No, it should be just the copayment, depending on the plan that she chose. So if she wants to give our office a call and let us know who that provider is, we can work with IMED and make sure that that's paid appropriately.
All righty. Richard answered an RX question. We have a question, best plan for someone seeking fertility treatments. She's aware that UK does not cover fertility, but can the PPO help with covering testing?
You know, the plans for the most part cover, what they cover is very similar. So I can't really recommend one plan over the other, just for the sake of fertility treatments. I'm sorry.
Let's see. If you sign up for a plan, say PPO, and then have a qualifying life event, have a child or divorce, are you eligible to only change who's covered or the actual plan as well?
So that depends as well. So let's say that you sign up for the PPO, and you do that because your spouse is, or because you, I'm trying to think. You have a child that is in college and they're out of state. And then let's say that child turns age 26 during the middle of the year and ages out. So you no longer have any reason, you know, to need out-of-network care. In that case, we would allow you to not only switch to the employee only or employee plus spouse if that's your only child, but we would allow you to move to the HMO at that time. So as long as the change is consistent with the qualifying event, that's the key.
Okay. And then let's see here. Someone messaged me privately. Is there a breakdown cost for pregnancy for the UK HMO? Labor and delivery, routine visits? Do you know, like, maybe a rough estimate? Have you been asked that?
It is all under the one copayment for the most part. I believe that copayment is $300. And that would be the inpatient hospitalization copayment. Now, I'm gonna state if there are complications or other issues, you know, after the birth, there could be other expenses, but just as long as everything goes well, it's $300.
And then someone just asked, is there a master list of in-network providers?
What you can do is go to the anthem.com website, and it'll, up in the top, it asks for the state. You'll select Kentucky, and then you will put in your zip code, and then where it says employer or plans, there's a drop-down box, and you'll actually see UK HMO, UK PPO. You can click on that drop-down box, and it will actually even allow you to select a specialty if you'd like to see providers based on the specialty, and that's the master list. They used to, years ago, have a hard copy list. It's just too much to keep up with. So online is the best way to go for that.
And someone asked if we could provide the slides.
Sure.
Great. I will email the slides out to everyone that joined today. Actually, we just received one more question, Gail. I thought we were going to be wrapping up. Can you talk about the upcoming UK HMO service?
The upcoming UK HMO service?
I'm not sure what this word is. I'm familiar with it. It's BARIATRIC.
Oh, bariatric service.
Bariatric. There we go.
So many of you, that's the bariatric surgery is the surgery, the weight loss surgery. And currently, the only plans that cover that, now this is an exception to what I said earlier, where most cases, everything is covered, if it's covered on one plan or not, and it's covered on all. But bariatric surgery was not covered on the HMO where it was on the PPO and EPO plans. HMO UK Healthcare is undergoing the process of instituting this bariatric surgery as a service that they provide. I don't have dates on it yet, and the last I talked to our UK HMO liaison as she was preparing the newsletter, because I know their newsletter had this in it. I don't have the exact effective date. I don't know if it'll be effective on July 1st, but the fact that they're advertising it tells me it won't be much long after.
Okay. I'm just sliding through to see if we have any last minute questions before we start wrapping up.
Okay.
Okay, it doesn't look like I have any questions. I just want to thank everyone for participating in this. Sorry about the volume experience we were having at the beginning. I appreciate you guys. Sorry about that. I appreciate you guys bearing with us. And I wanted to say a special thank you to Gail for participating and being our speaker today. I know a lot of people were having a lot of questions about open enrollment. And once again, I will send everybody the slides provided by HR today. And have a great weekend, everybody. Thank you again.
Thank you.
Thank you.